it is important to kind of have this compass that will guide you in terms of your journey. And that moral compass is something that I think leaders should develop. And instead of looking for one roadmap of success, this will sort of help them in their personal journey in whichever direction that they need to go. And then once they have got this compass, so to speak, and they've built their team with the right values, I think good things will come out from it.
Welcome to the Leading Minds podcast, where we delve deep inside the minds of the top life sciences executives. Join us as we unravel how they think, their vision for the industry, the purpose that drives them, and how they are moving the industry forward while fueling growth for their companies and their teams.
This is Leading Minds, and I'm your host, Jasmeet Sawhney. In every episode, we meet a leader who has made a lasting impact in the life sciences industry and continues to drive the industry forward. We go beyond the name and the title to unravel their personality, their beliefs, their mission, and most importantly, to understand how their brilliant minds are changing the world for the better. Before we get started, I want to thank our exclusive sponsor, Axtria, a leading global provider of cloud software and data analytics solutions to the life sciences industry. Now on to today's episode. I'm super excited to introduce our guest, Dr. Amar Sawhney. Dr. Sawhney is the CEO of not one, but three companies, Instilla, Regioni, and Permand. Instilla is a company focused on embolic therapies for hypervascular tumors and control of hemorrhage. Regioni is developing products for preventing intrauterine scar formation, and Permand is focused on developing biosurgery products. He was previously the founder and CEO of Ocular Therapeutics, Augmenix, Confluent Surgical, and the technology founder of Focal and Access Closure. Amar's innovations are the subject of over 120 patents in biomaterials and biosurgery. His inventions include several first-of-a-kind surgical sealants, spacers, and drugs approved by the FDA, including highly successful products like Resure Sealant, Dextensa for ophthalmology, DuraSeal for neurosurgery, Focal Seal for lung surgery, Minx for femoral puncture sealing, and SpaceOAR for prostate cancer radiotherapy. Amar and his partner Fred have created Incept LLC, which provides a platform to support other healthcare entrepreneurs. The list of awards Amar has received are simply too many to count in a podcast introduction, so I'll not even try that. But I do want to name a few. He has been named the Champion of Change by the White House and Outstanding American by Choice by the U.S. Citizenship and Immigration Service. Many consider him to be the epitome of the American dream. His companies and inventions have touched over 8 million patients and have created over 5,000 jobs. He's member of the National Academy of Sciences and a fellow of the American Institutes of Biomedical Engineering. Amar holds a master's and a PhD in chemical engineering from the University of Texas at Austin and a BTech in chemical engineering from the Indian Institute of Technology, New Delhi. Amar, thank you so much for joining us today and welcome to the show.
My pleasure to be here, Jasmeet. Thank you so much.
Amar, let me start by asking you about your professional journey. Some of us, including myself, have been fortunate to have had the opportunity to follow and get inspired by your journey. But I firmly believe many more people need to know about it. So it'll be great for our audience to hear, in your own words, the details around your background and upbringing, your education, entrepreneurial journey, and key events along the way.
Sure. I mean, that's a lot to cover in one response, but I'll try to sort of give some perspective to growing up. My father was in the Indian Air Force, and he himself was a self-made man and focused a lot on education. So while we were not poor by any stretch, we were not rich by any stretch either. So it was sort of a middle-class family, but he emphasized education and made sure that we were never lacking for those resources, and those values sort of helped guide us. Then my brother was, I guess, smarter than I am, and he kind of paved a little bit of the way coming out in the merit list, which is one of the, the toppers in the country in high school, and then eventually going to IIT Delhi himself. So sort of gave me a little bit of a pathway to follow. So that was helpful. Once I got to IIT Delhi, I took on chemical engineering, not for any particular love of chemical engineering, but because it was in Delhi. A lot of these decisions were sort of made to some extent by accident, but then oftentimes as what life gives you, you take what you have and you make the best of it. So once I went into chemical engineering, I finished it and I had a focus in environmental engineering. I wanted even then to do something about the environment. So that's what my undergraduate thesis was in. And then I tried to apply to academic programs here in the US in that area. And when I graduated, I also applied for jobs. I applied for MBA schools, and I had many options in front of me. And I had to make a choice as to whether I start working now. Didn't particularly want to do that, so that fell off the radar screen. Do an MBA or do a master's in a technical field. So this was sort of a tough choice. Many people were going into doing their MBAs, going into banking and stuff. I was always a little bit more technically inclined, and I like to make things. So I followed my instinct in that, and the University of Texas was offering me a scholarship to come to the United States. Also, it was intriguing to go visit the US and have somebody pay for it. I could always come back and do the MBA. So my calculus and all of that was, let's follow what my gut feels is the right thing to do and is an exciting, somewhat uncertain, somewhat maybe non-trodden path, and let's go do that. So I elected to come to the University of Texas, where I did my master's. And after I finished doing my master's in the field of biodegradable polymers, I wasn't a great researcher. I wasn't a great experimentalist. Hadn't gotten a lot of exposure to that in India. So I kind of cobbled my way through, did okay, made some polymers, got my master's degree, and then tried to look for a job. In trying to look for a job, I didn't have any work authorization. People didn't understand sponsorships for people the way they do now, where you can be sponsored for an H-1B visa and a green card, etc. So those options were not well established, particularly in Texas in 1989, where most of the jobs were with the oil industry or large chemical companies like Dow, DuPont, Exxon, Chevron, Mobil. These were the sort of the companies that came on campus, and none of them actually were overly enthusiastic about hiring immigrants with no work authorization. So my application process kind of fell to the ground like a lead balloon, and I got 30 rejections for all the places I applied to. So at that point in time, it was sort of a fork in the road, a reckoning as to what do I do? Did I actually make the wrong move? And should I recalibrate, go somewhere else, go do my MBA? What should I do? So this is the time where I sought wise counsel of my advisor, Dr. Jeffrey Hubble. And he was thoughtful, and he actually believed in me more than I believed in myself, and offered a route to do a PhD, which was never part of the original calculus for me. But I didn't also want to retreat. I always felt that I want to move forward. And so I decided to do a PhD, and that became sort of a very seminal moment for me in my life, and going deeper into technology, doubling up on the bet that sort of had not worked out so well so far, but eventually it turned out to be the right move.
Right. So, Amar, that's just amazing. 30 rejections and revisiting whether you had taken the right decision or not. And then the advice from the professor, right? How did it convert into the entrepreneurial journey that you are on? You've made such inroads and you've had so much success. How did you get into that entrepreneurial path?
So this professor, Dr. Jeffrey Hubble, was a relatively young professor. He had just been on faculty for the last 2 years or so. So he was somewhat of an unproven entity. But that did not bother me very much. And I just felt that he seemed like a dedicated, innovative, creative type of a person, versus some of the more senior professors who were more sought after, but were somewhat resting on their laurels. So it was, again, sort of taking a risk, like taking a risk on a startup. The work that I did with him And we had a postdoctoral fellow, Dr. C.P. Pathak, join, who came from the world of rapid prototyping, where they were making three-dimensional prototypes using laser scanning of some visible polymerizing resins. He brought some of that concepts. I brought some of the degradable polymer and water-soluble polymer concepts. And the two of us, along with the guidance of my professor, created these materials that could be polymerized in the contact with living tissue. So you could do the same ultra-fast polymerizations that people were doing in the industrial side, but you could do it for the first time with visible light at neutral pH in physiological environments with living tissue without harming even the first cell. So this was pretty revolutionary to be able to do this. And that, once we started publishing, we started talking about it, we started patenting it, attracted the attention of a venture capital group, the Mayfield Fund out of California. And they were looking to start a company which was going to work on using polymers with or without drugs to solve local diseases like restenosis after angioplasty, local diseases like adhesion prevention, surgical sealing. These types of problems they were looking to solve, and they felt that the technology we had perfectly fit with that. So they approached us at the University of Texas, licensed that technology, and decided that the company would be set up in Cambridge, Massachusetts. So with that, after I graduated, they wanted the person who had helped build the technology to come be the first employee. So I literally got catapulted from my academic PhD into being the first person in a startup, new company, new city. I didn't know anybody here. My advisor also took a 1-year sabbatical, came there. So Mark Levin, who was with the venture capital fund, and I were the three people sitting in an empty room trying to figure out how to build a company. So that's how I got started on my entrepreneurial journey.
And that was Focal. Is that right?
Was Focal, yes, 1992.
Since then, you have incorporated so many different companies and had so much success with so many different companies. So can you talk a little bit about how you kept on moving from one company to the other, and one after the other, you had so much success? So talk a little bit about that so the audience knows the depth of your experience.
Yeah, so I think success would be one way of putting it. There were some initial challenges, and I want to talk a little bit about challenges, because what I don't want it to appear like is that life is just one big rosy journey, because it never is. There are always challenges. The key is, do you let the challenges defeat you, or do you learn something? Because sometimes the challenge is basically telling you that the conventional way of doing things may not be the right way. There may need to be some additional creativity that has to be brought to bear. So let me talk about what I mean by that. So when we did Focal, I was a junior graduate student who'd come in. I was the technology founder, but I wasn't running the company. So, and my equity position was diminishing decimal place. So in this process, I wanted to make sure that I discharged my responsibility, which was to create the product, which we did, run the clinical trials, which we did, get the product approved through the FDA, which we did, take the company, be there on the roadshow, company went public. So I helped with all of that. But after that, it was a question of now doing the next thing and the next thing. Is this the most optimal vehicle to do that? I felt that I wanted to do it on my own, and I wanted to license some of the technology from them, some things that they had worked on and were not going to pursue in the future. So I thought that would be an easy ask, that you're not going to work on this part of the technology. Can I have it? And I'll give you 20% of my new company that I found. And I don't want anything else. I don't want any money. I don't want any people, nothing. I thought it would be an easy response saying, sure, we'll do it. But they thought about it for 3-4 months and said, no, we're not going to do it. It was quite a crushing blow at that point in time. And I was getting demotivated, coming into work feeling like I'm not making progress, and I'm drawing a good salary. They're paying me well, but it's really not exciting, not fun. So when you reach that stage of sort of discontent, you can either sit there and blame the world and complain about the company and complain about all the things that are wrong with the system, or be positive and action oriented and say, you know what? I have tried my best to convince these folks, but they're not getting it. So it's okay. Let's go do something else. So I went back to my basement and started thinking about new ways to do this. So looking at other chemistries which are non-light based. And I went back to Focal and said, you've given me this so far. I'm thankful for it. But from here onwards, I have to go on my own journey, and I'm going to do it with my own technology, and please let me go. So they reluctantly parted ways with me, let me consult for a little while, and said, don't compete with us. So we kind of came up with a separation agreement. And I came up with new technology, which was not based on light, but very fundamental again. And this time I said, one thing that I've learned is that if you take a very broad-based technology and put it into one operating company that has a certain amount of funds raised in a certain budget, it cannot do everything. So there has to be a better way to do this. And the better way to do this maybe is to put it into a holding company structure, wherein you license the single thing that you're going to work on and raise funds for that, but don't put all the technology into the first company, because eventually it becomes not your company. As more shareholders and investors are added, you become a smaller minority shareholder, and you cannot call the shots at that point in time. But if you set it up a priori in such a way that you don't have everything in it, then you retain the ability to do the next company and the next company and the next company. And even better, if you're allowing the companies to upload technology into this mothership holding company, the base of the mothership holding company's technology expands and continues to grow. So it becomes a sort of a snowball that gains momentum. And that has allowed us to create multiple companies using the same technology in different fields, because the different fields call for customer intimacy in a particular area. So one day you're dealing with neurosurgeons, the other day you're dealing with interventional radiologists, the third day with gynecologists. No one company can have reps that can call on all these different fields, especially not a small startup. So to be able to kind of focus yourself based on the field, but at the same time, the base technology to allow that to be uploaded up to the mothership that can then wait until the right time to create the next and the next company, is how we did it. And that allowed us to create multiple companies. At the same time, I partnered with my friend, guide, and advisor, a gentleman by the name of Fred Koshravi, who's out on the West Coast, who I had met at Focal. And he himself, now an entrepreneur of great accolades in his own right, and on the West Coast. And he and I have been partners now for 25 years in this holding company, where we've created 25 companies. And he is very interventional focused in medicine, dealing with cardiology and neuroradiology, etc. I am more surgically focused, and that partnership has allowed us to scale, help each other, be each other's supporter, but be on West and East Coast respectively, mechanical and chemical, different skill sets, but the same value systems. And this has allowed us to sort of continue to scale and build, and we have built now 25 companies in the last 25 years.
That's just mind-blowing, right? And then just the thought of coming up with this holding company at that early stage of your career, that was revolutionary in its own sense. Can you tell our audience, had you seen those examples? How did you come up with that thought?
It's one of those things when you get knocked between the eyes with a 2x4, you pay attention and you try to figure out what else. There's got to be another way. It's like being locked in a room and you're saying there's got to be a way out, and you get creative. So and this is the subject of a Harvard Business School case that we wrote, was written about Incept. And what happened is that there wasn't something which had a parallel. People either had incubators, wherein it was facilities and building and space and admins and photocopiers and this kind of stuff, or lab facilities that they provided. But what we realized is what people really needed was intellectual capital, both in terms of patents and technology, and also about know-how about how to set up companies and how to go forward. So we felt that this needed to be an intellectual capital holding company as opposed to a venture group which invested money, or an incubator. So we didn't like either of those models. Okay. So we became sort of intellectual capitalists. And then the second thing was to be able to, now you have this vision. The question is, will the rest of the world see this the same way?
Yes.
So when we went to raise money, the venture capitalists initially had a problem with this because intellectual property is considered to be their safety blanket. If the company goes kaput, at least they can sell the intellectual property to somebody. If the intellectual property is not within the company, what do they have? So they were not convinced initially. But what we said is saying, guys, trust us. We're good people. We're not doing this to try to pull up some funny stuff or where you create the company and then we go in and saying, oh, thanks very much for funding it.
Yeah.
We need more technology. And by the way, that more technology is going to cost you more money. Coming up with some funky stuff like this, we said, if there is any need, we think that things are not working out or whatever, we'll swap out technology. We'll add, because unless this is successful, this first company, which was Confluent Surgical, is successful, the whole model caves in. And why would we want the whole model to cave in? Because we're doing it precisely so that we can scale this. And we will work with you again and again. And there will be synergies that come for the future. So some of them then started seeing it, and we had Schroeder Ventures and Spray Ventures kind of agree to invest in Confluent Surgical. And this, at that point, we were also looking with strategic partners to get their investment. And I had sat down with about a dozen lawyers from Medtronic who were trying to figure out how this thing works and why they were not convinced initially. Eventually, at the time of the sale and exit of that company, everybody kind of felt comfortable with it. And once both the entry and the exit seemed to work out with this type of a model, people stopped objecting to it. And the investors who had invested in the company early on through this journey were ready to invest in the next one and the next one. So that model then got traction. Both the entry and exit being viable allowed us to do it for other companies. And suddenly we had an intellectual property platform that we owned outright, but could now be used to create multiple companies.
We'll continue the conversation after this quick message from our exclusive sponsor, Axtria.
Improving commercial and patient outcomes. That's our goal at Axtria. We are at the forefront of life sciences digital transformation with the most advanced cloud software and data analytics solutions, enabling companies to manage data, derive artificial intelligence-powered insights, and streamline business operations across the product lifecycle. Because of our deep expertise in the life sciences domain, we are the top choice for life sciences companies for their digital and business transformation initiatives. We work with all of the top global life sciences companies who consider us their true partners, driven primarily by our most important differentiators, our people, and our inclusive and progressive culture, which is focused on developing the life sciences leaders of tomorrow. With every project, we are helping our customers achieve commercial success. But more importantly, we are helping them improve health outcomes for patients. See what we can do for you at axtria.com.
So, I want to now focus on a little bit about your current roles and responsibilities. As we said, you're running 3 different companies as the CEO. In addition, you have other responsibilities and you have other companies. You're involved in various capacities. You're involved in a lot of the social community, nonprofit work. So many people are kind of stunned by this. Can you tell our audience, how do you kind of make it happen? And what are your current roles and responsibilities?
Sure. So, look, we all live in a world of intersecting circles. Intersecting circles where we have responsibilities to our community, to our family, to our professional life, to some of our hobbies and recreational friends. So there are all these things that one has to balance. And I'm no different than other people in that regard. Yes, I may have quantity-wise more things that I am balancing, but this nature of balance is something that all of us have to contend with every day. So let's talk about the professional side. The professional side, as you mentioned, sort of I'm running a few different companies. What makes it useful is that they share the technology platform. So that allows for certain synergies in which we deal with these types of problems, whether it is discussions with the FDA or manufacturing or clean rooms or supply chains. They are somewhat similar and synergistic. So that allows for some sort of ease of operation and synergies. Similarly, the strategics, the investors, the board, a lot of them are somewhat similar in this regard. And so consequently also allows for certain synergies. It simplifies life. Then I rely a lot on my senior management, so presidents and general managers. So usually in a startup, people won't have a CEO and a president as a separate role. People tend to be president and CEO. I have found the value of separating those two roles by giving somebody a very senior role within the company and giving them that reasonable compensation equity position and allowing them to be the person that does the day-to-day operations and then helps me scale because it frees up my bandwidth to be able to be more strategic. And if I find people that I have worked with in the past or come highly referred, it has to be a very exclusive club of those people. But then once you kind of find that they are making decisions as well as you would make, or sometimes even better than what you would make, that is exactly what you want. So this is something that I've been fortunate to be able to work with several people that I've worked in the past with in many companies. They know the businesses, they know the technology, and they know the people. And the value system that you introduce then allows you to sort of have these folks kind of continue to create companies and do the day-to-day operations and allows me to scale. So that's something on the professional side that has worked out quite nicely. We even sometimes share employees and it creates cost synergies. We share quality systems, manufacturing facilities. So it gives you a lot more ability to be capital efficient and that becomes a competitive advantage. So that's one thing. Then the question comes about, why are we doing what we do? So you have to sort of search within yourself and ask the question, why are we working hard? Why are we, sometimes obsessing, raising our blood pressure, taking on stress? Why are we doing this? So when I look at within myself, there are two reasons why I'm doing this. One is that some of these problems are very solvable with the type of products that we can make and the technology we have. And if we don't do it, there is a strong chance that some of these things will never be done. And these products will never see the light of day. And if that is the case, then we have been negligent in the privilege that we have been given to be in this position that to create these products, and we have not discharged our duty. So that keeps me going. And then the second part that keeps me going in this is that you are creatively engaged with great people of value systems that are congruent with yours, which is doing the right thing, keeping the patient at the forefront of this, and not adding cost to the healthcare system, but finding ways to make the healthcare system more cost efficient. These types of things and solving real medical problems that are meaningful problems are other things that sort of keep you going in this process. So that is what sort of excites us to be able to do this and makes life more meaningful and pleasurable. So that is kind of how I balance the professional. Then on the personal side of things, I do make sure that I take time for family. I spend as much time as possible with the kids and my wife, who have been extremely supportive through this journey. My wife, Deepika, has been extremely supportive through all of this. And now our kids are both going to be going to college. So because of that, now I have been able to discharge that responsibility. And now some bandwidth that frees up more and more, so I can assign it to some of the causes, charitable causes and not-for-profit causes that I hold dear, whether they are in education and sort of poverty alleviation. But my main passion is the environment, preventing wildlife trafficking, and being able to do things wherein species that are at the threat of extinction, man-animal conflict that might be happening, and trafficking of animals and animal products are the things that I would like to continue to work on. So I think these things, and then obviously one has hobbies of like
Yes.
we all do, and I do find some time to be able to spend with friends pursuing those hobbies. So it's a balancing act. I can't say I'm perfect at it, but I'm pretty happy with how things are. So the question is, what does one strive for? One strives, I think, for contentment, not for
Yes.
maximization of wealth, but strives
Mhm.
for contentment. And if you feel you're content and you're doing an adequate job balancing all these different balls, then I don't think there's much more there to life. I'm happy.
Yeah. It's difficult to find someone who's probably more perfect in this, but it is pretty hard to do what you're doing right now. To find another business leader who has driven so much impact in the industry, I think it'll be an impossible job. In fact, I think you're considered one of the leading pioneers in the biotech and healthcare industry. So it behooves me to ask, where is the industry headed? Can you talk about some of the major shifts that you're seeing in the industry and key factors that are driving this change?
So look, my depth is more on the medical device side. While I have created some biopharma companies and I am involved with analytics companies and diagnostics companies, etc., that is more where my pattern recognition kind of comes into play, and I'm able to
Right.
offer advice from a board level to be able to help there. But my real depth is in the MedTech sector,
Mhm.
where I've
Mhm.
done principally most of my work. So I'll speak more from the MedTech side of things because I don't think I'm the right person to speak on all fronts, whether they are services or things. So on the MedTech side, what is happening is that there is a lot of the incremental innovation that had to be done. So there are these different pathways, right? There are 510K pathways, which is I'm a device just like something else kind of a thing, and they're incremental innovations. They're not revolutionary type of innovations.
Yeah.
And then there are more revolutionary innovations, which are PMAs. And those PMAs, pre-market approvals, will need a lot of sort of, clinical trials and, things of that nature. And then there are sort of combination products that combine biologics and drugs and things of that nature. I think the incremental innovation stuff, while hundreds, if not thousands of 510K still get filed and issued, cleared by the FDA every year, that's not where the innovation is truly happening. Those are very, very small, and it's becoming increasingly hard to find investors who want to invest in those types of ventures to be able to kind of gain sizable market share. So what's happening is new ways of solving problems, whether they involve materials, whether they involve, for example, you take a company like Shockwave, which is breaking up calcified lesions to open up arteries, whether they are things where, electroceuticals, where electrical impulses, not only from neuromodulation, which has been around for some time, but being able to kind of address different therapeutic areas using that, whether it is robotics, wherein it is not just the promise of kind of, making it look fancy, but actually do meaningful things. At Imperative Care, for example, one of the companies I sit on the board of, we're looking at ways in which we can really make telemedicine a promise of telesurgery, because there are not as many people, neurointerventionists around in the country to be able to do these procedures across the country. And this is in one of the most advanced countries in the world. So how do you kind of reach people who may have a stroke and maybe hours or if not days away from a comprehensive stroke care center? How do you treat those people? So solving these types of problems, which are real meaningful problems with innovative technologies, sometimes using robotics, sometimes using biosurgery, sometimes using biologics, sometimes using electrical impulses. This is kind of where the field is going, that the low-hanging fruit has been somewhat harvested. Now you have to think creatively and look at solving big, meaningful problems and changing care pathways sometime altogether. So you're not just looking at the same care pathway, but approaching it completely differently. We did this with SpaceOR, where the usual pathways were to create bigger and bigger machines, going from image modulation, radiotherapy, to massive proton beam centers that was the size of a football field kind of a thing, machines that went from being $1 million machine to $150 million machines. I felt that type of innovation was just sort of brute force innovation. That was not thoughtful innovation. So with us coming up with a material that could be injected as a liquid to form an implant not much bigger than your thumb, and to be able to improve outcomes more so than had been done by some of these massive machine improvements, all within a few years, was, in my view, the type of innovation, type of sort of different type of thinking that we could do by eliminating all the side effects, giving massive benefit to the patients, and being able to revolutionize radiotherapy from 40 fractions down to 5 fractions, doing things so that the whole care pathways change. Now think about it. If you're a patient coming in from some remote village out to Boston, Massachusetts, about, traveling 200-300 miles, and you have to get 42 sessions of radiotherapy for prostate cancer, and now you can do it in 5. Instead of staying a month and a half camped out in Boston for 5 minutes of radiotherapy every day, you could get it done in 5 days, in less than a week. That's a huge, meaningful thing for the patient, especially if you don't end up with lifelong side effects. So my point is that the industry needs to look at things like this and not just accept status quo, and be able to look for meaningful improvements as opposed to incremental improvements. So that's kind of where the device industry seems to be headed, and that is what will drive real, the next large companies to be created.
Thank you. Those are some incredible insights into the future of the MedTech industry and the major shifts that are taking place. Now, you and your companies and your innovations are playing an important role in this industry's future. So many congratulations on that first. Coming back to your career and professional journey, we have talked about the peaks and valleys, right? The successes and the failures and the roadblocks that you've seen. And you also touched upon some of the things that have impacted your career. But do you want to talk about some of the events and decisions or people that were important along the way, that made an impact on your career?
So people-wise, I think I can point to 3 people. I already talked about some of them. One was Dr. Jeff Hubble, who was the professor that sort of put me down the technical path, a PhD pathway, and helped with this foundational technology. So a very meaningful guide and mentor. When I went to Focal, Mark Levin, who was the venture capitalist from the Mayfield Fund and still is with Third Rock Ventures, a very senior partner, and is now doing very interesting things in a city school education. He was just a great mentor, not only an immensely successful fundraiser and consummately sort of networked, but a hugely wonderful human being, very compassionate, very thoughtful. He would ask open-ended questions. So you would be able to open up and talk a little bit more about things. He is the smartest guy in the room, but never acted like it. He would always want to learn more. So watching how he operated, and you come in at 7 a.m., he would have been already on the phone talking to people in Japan, and you left at 7 p.m. and he would still be on there talking to some other country. And he was the hardest working, most thoughtful, never lost his temper. So he was, how to actually conduct yourself. He was a hugely important individual. And then finally, my partner, Fred Khoshravi, who is sort of a prince of a person, meaning he does come almost from royalty back in Iran, and he's Kurdish. What I've learned from him is just how elegant he is, how thoughtful he is, how compassionate he is. He's a great friend. He inspires loyalty. So learning all of those things, and he is so elegant in what he does, whether it is artwork, I think if he weren't an engineer, he'd be an artist. So learning all of those elements from him, so lots of people are successful in these material ways, but do you make your journey pleasant for other people too? And you're not just leaving a field of bodies strewn after you've been through your path of success. So making that process enjoyable so that there are few people who wish you ill. So I am lucky in this regard that I have few people who wish me ill. At least that's what I think. I could be wrong, but So far, I've not found too many people, and we try to treat people well, and this gives us the ability to work with them again and again. So,
Right.
so these
Right.
have been the sort of the mentors, if I would say, for me.
I've had the fortune of meeting and knowing Fred out of them, and he's simply amazing. Of course, through you, but it's simply amazing. The kind of individual and gentleman, how he conducts, how he goes about. Just having a conversation with him makes you feel so inspired. So thank you. Thank you for sharing that. Now, there are so many people in the audience who are on their own leadership path. Can you tell us what are some key attributes of a leader, and what advice would you have for someone who aspires to be a leader like you?
So, firstly, I think any journey that we are on, there is no roadmaps to those journeys because everybody's journey is going to be unique. I have had a certain journey. One can look at it and learn something from it, but everybody's journey is going to be unique. So, instead of looking at sort of what to think, I try to focus on how to think. So if it's even for leadership in terms of how to think about stuff. So firstly, I think any leader should have a value system that helps guide their behavior, their pathway, their thought process, all of these types of things. So the value system that we tend to hold dear is the following. Work on something that is really meaningful. So that if you are in some period going through some dark, deep, depressing time where nothing seems to be going right, you can ask yourself, well, why are you working on this stuff? And the answer is because it was worth doing, because this is a problem that I still believe is worth solving. So work on something significant. So consequently, some people may regard that as significant, but I have chosen not to work on any cosmetic surgery applications, for example.
Right.
So work on something significant. Then second is, work with people who have a congruent value system but have orthogonal skills, which means their skills are very different from yours, but their value system of how they think is very similar to yours, which forms the basis for a cohesive team where you respect each other and the teammates. So when a leader builds his or her team, they should look for these types of people to be able to build their teams where they can inherently rely and respect them for the skill sets that they bring, but their skills are different so that they are helping you shore up your weaknesses. And a leader who is aware of not only their own strengths, but more so of their weaknesses and acknowledges their weaknesses and does something to fill those weaknesses is, again, a good self-aware leader. So these are things that sort of, having your value system, how you build your team, and then good outcomes will sort of come about from it, whether it is financial success or reputational success or legacy or whatever. But you don't approach it by asking to be monetarily successful. Sometimes people will build startups with the objective that they want liquidity. I'm like, no, that's not the right approach. The right approach should be, is this a big problem? And do I have a hope of elegantly and properly solving this problem? And in that case, if it was a big enough problem and you do have a good enough solution, the financial success and all these things will be there. But you don't approach it from the standpoint of financial success first, because when you put that first, you start working with people who will just help you achieve financial success. And there is a whole bunch of nefarious people who are only driven by money, who you will then fall in line with. And soon you'll realize you've completely lost your way in the types of things that you were trying to achieve in the first place. So it is important to kind of have this compass that will guide you in terms of your journey. And that moral compass is something that I think leaders should develop. And instead of looking for one roadmap of success, this will sort of help them in their personal journey in whichever direction that they need to go. And then once they have got this compass, so to speak, and they've built their team with the right values, I think good things will come out from it. So I think that has sort of been my approach to leadership, and then empowering people to be able to make decisions, watching over the process on a weekly basis. That allows us to sort of also give people the opportunity for growth and have a path and career trajectory. And that allows me to be able to scale, because now once we develop these types of leaders that we can have confidence in, we can gradually give them more and more responsibility. And there is an unseen chain that connects good people who are able to analyze and understand who other good people are, and they will do a good job in hiring. And then everything becomes that much easier to be able to do. If you're micromanaging people, you're not empowering them, and you're not hiring the right people, you will find that leadership becomes much harder. Now, this is not to say that we won't make mistakes along the way. If hiring mistakes happen, oftentimes the organization knows it, and you may be the last person to actually understand it. But being aware, listening to the organization, and being able to rectify the mistake, whether it is a hiring mistake or overhiring or underhiring, those types of things need to be thought through. In terms of product development, there is always the opportunity that you haven't done enough background research to understand whether or not the market really needs something like that. So making sure that you do enough market research with the customers and talk to them enough to be able to understand whether the product is really needed. But oftentimes, entrepreneurs tend to fall in love with their idea and are reluctant to hear that that is not such a great idea. It's very hard to correct these things in retrospect. So it's better to do a lot of this stuff early on, before you embark on the journey and before you have significant emotional and financial resources committed to it.
Amar, I love the advice that you have, because it's foundational and focuses so much on values, purpose, and meaning. And as you said, once you have that, it's much easier to scale. So have the focus on those things. That was my last question on the main segment. But now on to the fun segment. I have some rapid fire questions, actually just 3 of them. And I'd like you to respond quickly to them. Are you ready for it?
Sure.
All right. What comes to mind when you hear the word leadership?
Service comes to mind, in terms of being a leader who is not just sort of being out in front, but sort of, service oriented, to be able to be an example.
Awesome. What do you do in your free time?
Well, I play golf. I spend time with family and friends. We like to travel.
Amazing. Name your favorite book or books.
So there are many. I think one book that has sort of particularly stood out, which I thought was a very interesting read of a topic that otherwise would be considered dry, is a book called Americana, a 400-year history of American capitalism. So this actually really goes through all the different waves. And, we tend to think that the latest and greatest wave, the AI wave or the internet 1.0, 2.0 waves was remarkable and novel. But these waves have come about in the past many times. Telegraph was a wave, railways were a wave, the canals systems for navigation were a wave. And it is, once you sort of get a zoomed out perspective of some of this stuff, this can be quite illuminating in sort of, seeing how businesses develop. Another one is The Revenge of Geography, which tells you sort of, we in the US have been fortunate to be somewhat isolated, unlike being in Europe or being in Asia, where, you've got constant wars and stuff that can happen within your borders and stuff, and Ukraine being an example of that. But The Revenge of Geography is very, very important to see, what assets of oceans and mountains, these are not assets that money can buy in any way, and how, empires kind of shape themselves. So that's another good book to read.
Awesome. Amar, I love those responses. I absolutely loved the Q&A, the rapid fire, and all the perspectives that you've shared with the audience. You've had such an incredible amount of success. And as you said, success is not measured in terms of wealth and other things, but what are you able to do in your life? And I think you talk about the balanced ecosystem and really looking into perfection, but looking into how you balance your life. And you touched upon that. You've made a lasting impact on the industry. The impact you're making is helping millions of patients. And I think you talked about the purpose and the meaning. And I think there's no more noble cause than that. So many congratulations on all that success. And thank you again. It has been an absolute pleasure chatting with you.
My pleasure. Thank you for the opportunity, and Godspeed.
Thank you. To the audience, you are the most important part of the show. Because of you, we are the top show in the life sciences industry. Thank you so much for joining us today, and tune in soon for the next episode of Leading Minds.
Thank you for listening to the Leading Minds podcast by Life Sciences Voice. Please share and hit subscribe with your favorite streaming platform. For more information, please visit our website at lifescivoice.com.